Hello and welcome to Level 3 Health and Social Care, Unit 7 Dementia. So this is Unit 307. And we're looking at week 3 now, and we're looking at our Part 5 PowerPoint, where we're focusing on treatment and support for users in the early stages of dementia. So the objectives for the assignment that we're looking at is Objective 3.1, explain the treatment and support available for service users when initially diagnosed with dementia. And one of the things we need to remind ourselves is there is actually no cure for dementia. So treatment is really to help reduce the symptoms and to manage any of the changes that come around as best as possible. So, although there are medications that can be taken, they are not to cure it, they are not to make it go away, but they do help to reduce symptoms, and that's what we'll be looking at. The first medication treatment that we'll be looking at is something called acetylcholine steroid inhibitors. Okay, it's a bit of a mouthful. They are known. The drug name is donepezil, or Aricept, depending on which country it's being sold in. And there's another one known as regastatin, which is known as Exelon, and galantamine, which is Remenil. Okay, so depending on which country, that's what you'll recognise. Aricept, donepezil, Exelon, Remenil. And they are used to treat the symptoms of mild to moderate Alzheimer's disease, so generally early stages. Although donepezil they can carry on and use to help with people later on with the slightly more severe stages. There's evidence that as well as Alzheimer's disease, these medicines will help people with Lewy body and Parkinson's disease dementia, and some people with the mixed dementia, which is Alzheimer's and vascular dementia. There's no real difference in the medicines. One may be preferred over the other for different things. It does have some side effects in the first couple of weeks, usually nausea and loss of appetite, but after 2 weeks they tend to get better. And the real effect of these is to sort of reduce the symptoms a little bit. And some sort of feel that they may slow down the development, or there's not really clear enough evidence on the actual time factor, but it can reduce the effect of the symptoms, so people can manage better. Another drug that's quite well known is memantine, also known as Namenda, depending again on where it's sold. And this is given to people sort of later on for moderate to severe Alzheimer's disease. And again, it can be given to those with Lewy body dementia and those with a combination of Alzheimer's and vascular. And those who can't take the earlier drugs we were talking about, this memantine can be used for those. So they might use those in early stages with people who don't tolerate the acetylcholine steroid inhibitors. And this works by blocking the effects of a chemical in the brain called glutamate. So if there's too much glutamate in the brain, it will reduce that. Again, it has some side effects in the very early stages of use, but people sort of try to, soldier on through them. And it can include headaches, dizziness, and constipation. Again, its main work is to reduce the effect of the symptoms. And again, some people say it can sort of slow down the deterioration. Jury's still out on that, but it definitely reduces the effect of the symptoms. Other treatments, medicines are okay, but as we know, they just sort of reduce the effects of the symptoms. But there are other things we need to do to help support someone with dementia so as they can live well with their dementia. One of the first things we think about is cognitive stimulation theory, which is something that anybody can do with their loved one or with someone that they care for. And that's taking part in activities. Often group activities are good because they're a bit more stimulating, but they can be one-to-ones as well. And things designed to improve memory, problem solving skills, language ability. So they can be simple things like spelling worksheets, especially on the areas where they struggle. In my graphic here, I've got the classic sort of match two card game where you turn it all over and you keep trying to remember where the partner card is. Something that maybe we used to play as children, but actually it's quite stimulating with memory. It helps you remember where you saw things, and it's very orientating as well. You don't need to be specially trained to do cognitive stimulation theory. You can download worksheets, which can be quite helpful. There's a little worksheet on my graphic here to the right, um, where it's talking about memories that are based around a song. So you can have discussion groups around them, or you can just sit with, your elderly grandma or your mum or dad if this is happening to them, and stimulate some of these conversations. So it doesn't need specific training, but though if you do speak to the occupational therapists in the dementia service, they can give you some ideas, but you can find quite a lot of these things online and do them. And you can find some apps as well that you can put onto your phone that someone could do. But these are quizzes. I remember when I had a Nintendo, one of the games they used to play was something called Brain Training, which had lots of quizzes and sort of like number games and that, and those sorts of things would be quite good cognitive stimulation theory. In fact, we used something very similar when I worked in a day service with small groups. We use the Nintendos to actually play those brain training games and do some of the tests as well. So those sorts of things, and it could just be something as simple as quizzes and crosswords as well, because it means trying to remember words that you might not have used for a while. So anything like that, a little bit of simple mental arithmetic can be good, some little puzzles. So anything like that is just general stimulation. Moving on to cognitive rehabilitation is a little bit more complex, needs a trained professional really to set it up and organize it, and to use and to create the correct activities. But once they have been set up, the OT or the psychological therapist can actually, once they've set up the quizzes, you can carry them out for them. And the aim really with cognitive rehabilitation is to sort of achieve a particular personal goal, such as relearning to do something that you did before. So if you can't remember the sequence of making a cup of tea, or if you can't remember the sequence of using your mobile phone, they would set up the rehab step by step for you to do that. And then what they would probably do is get sort of, close family member, a relative or a friend to actually do the regular work with you to do it. And then they would probably catch up with them and review things. So the idea is it's getting you to use the parts of the brain that is working to help the parts of the brain that isn't. And that's usually done in the early stages of dementia. And it helps people to retain certain skills that they find quite important as part of their life. Like using a mobile phone, if it's the way they communicate with everybody, they don't want to forget the steps of how to use their phone, or if it's making a cup of tea, that's an important part of their independence. So it helps. The idea is to help people cope better with their condition, and it really is to use the bit of your brain that is working to stimulate the other part of the brain. So, which is why it often really needs to be planned out by a trained professional. Reminiscence and life story work is something that we can do with people. It's something that people often do in day centres, or sort of group work. And it involves talking about things and events from the past. Very often, people's memory of their past is better than their memory of their present. So that will still keep their brain stimulated and get them to sort of try to focus. If you do it in a group, if someone gets some sort of confused memories or something, you might have someone else who will have a better memory of it, and together they can sort of work out what really happened. So reminiscence work, again, you might works well in groups. You can talk about a particular song, maybe from 20 years ago that was very popular, and people talk about their memories of it. What were they doing when that song was around? You know, what were their relationships? Where were they going? Where did they hear it? That sort of thing. And it's also to encourage conversation and social interaction as well. Again, you can do that. You don't need particular skills to do it. There are lots of things that you can download on the web which can help you, like props and ideas for reminiscence work. You can buy books of it, actually, of activities. Life story work involves sort of compiling, getting photos, notes, keepsakes from the childhood to the present day. You can either make it into a book, or it can be a digital version, or it can be, as in my graphic, posters. I've worked with people very often to create posters that they like to put on their room in the care home. Um, and it's great because you can sit down with them if you have sort of a few minutes in between what you're doing. You can just sit down and sort of use that poster as a conversation. Like, is that your daughter? You know, oh, you know, how old was she when this picture was taken? Those sorts of things. So if you can have a look at sort of my poster in the graphic there, you can see. But some people actually create sort of big scrapbooks as well, you know, like in a ring binder. It really depends if the person's got a lot of family photos at home. Again, you'll need family help. Grandchildren might help putting things together as well. You can bring in, ask people to go through their drawers and see if there are tickets and things from events that they went to. Some people keep a lot of stuff, some people don't. So it's, you know, you're going to have to work it out. But it does take a bit of work from the carers to sit down and help people create their life story books, but it's incredibly rewarding. And once they've got it, they can add things, you know, even though they're in the care home, they can add activities to it at the end, you know, something I did this week, you know, if they all went out on a shopping trip or something, you can put some pictures in, things like that. They definitely improve mood and well-being. As I said, they're great for social interaction, helping people with memory as well, but also reminding people of all the things that they've done and achieved in the past. Because, as we know, when people suffer from dementia, they may have had some great achievements, so they feel very frustrated that they no longer the person that maybe that they might have been, you know, where they've done very good things or carried out a very important job, something like that. And you can, and it's about giving them some positive vibes about focusing on the things they have done in their lives, you know, rather than focusing just on the dementia that they've got now. Just because they've got dementia doesn't mean they can stop doing some of the things they enjoy. If there are general activities that they enjoy and they can do them safely with you, then you want to try to keep people doing an activity as long as they possibly can. So if somebody enjoyed playing golf or fishing or gardening, then just because they've moved into your care home doesn't mean to say you shouldn't try and find ways where they can still keep doing that activity. If it's a physical activity as well, as long as it's not more strenuous than they can manage, you can find a way to maybe adapt it so that they can still physically keep doing it, because obviously that's keeping their body healthy as well as their mind healthy. And if they can share that activity with somebody else, even if it's just them and a carer, going to play golf together, I mean, that can be really stimulating, and it can make people feel very good. It's quality time as well, really. So you can carry on with people that they can already enjoy, although they can take much longer doing it. So instead of maybe doing a 19-hole golf course, you might be able to get a shortened 9-hole one, because that will still take them a while. Or they might decide that, they don't physically want to do things like that anymore and they want to find new activities. So you might have to help them sort of look into what can they adapt to sort of things that they enjoyed into a new activity for now. And one of the things that's really important is to stay socially active, keeping in touch, particularly with old friends, and meeting up with friends and family, depending on how important they are to the person's life, are very useful. Some other things that people with dementia have found quite enjoyable as well is dance and movement, walking groups, because again, that's good for your body too. Um, and it's very sociable. There are dementia-friendly swimming gyms and walking sessions, very specifically aimed at people with dementia, which means that the people who organise them will have the training and knowledge to sort of look out, to think about the routes, and to do stuff that doesn't cause them any distress. You can actually get dementia-friendly cinemas as well, a cinema showing. So if they used to enjoy going to the movies, but maybe don't find sitting in the film that easily, you'll find quite a lot of cinemas now have a dementia-friendly session. Often it's earlier on in the day. Often they don't turn all the lights down so that people are not in the darkness and don't get too confused. They often have the sound reduced so it's not too loud because sometimes people can find that distressing. And they're sort of well able to cope if someone gets up and wanders around a little bit or, loses focus on the film. Whereas if they were in maybe a normal showing of it, people would complain and people would start shouting at them to get out of the way and stuff. So do look out for things like that because they can be very, very helpful. Art groups, drawing and painting classes, people have found when they struggle to express themselves with words, expressing themselves with pictures and painting, even if it's something they've never really done before, people have found very therapeutic. There's some local areas have a memory or a dementia cafe where people can actually drop in, and again, the people who run it have got training and experience in working with people with dementia, and they will often have the place will be decorated with stimulating ideas, and they might have things around that people can actually look at, magazines and things to um, inspire them really. But it's a place where they can drop in where some of maybe the behavioural side effects of their dementia is handled by the people who are there, and people don't get offended by it, and such like. Singing for the brain groups. The Alzheimer's Society has run singing for the brain groups. They're certainly spread out all over the UK now, and they are becoming quite a big thing. Um, People tend to remember songs longer than sometimes they remember words, conversational words, but somehow they remember the words of songs that are very popular. And they can have a lot of fun doing that. The instructions tend to be quite simple. It's not really about being a great singer, it's just being about a group, group sing song, really. And they've proved that there's been a couple of TV programs about the dementia choirs and things like that which have been run by some famous people, and they've been quite interesting to watch, really. And they certainly improve people's mood and well-being, and they look like they have a great time. Because if they can't remember the words, something, the words are printed out for them and that, so they can often join in. And somehow they'll remember the tune as they go along very often, or they'll just get carried along with the rest of the group. But they're quite energetic and they're lots of fun. Of course, tablets and smartphones now have so many apps on them that we can make use of, can be really useful for people with dementia. You can set alarms. Um, People can actually get, as we know, telehealth allows you to do your medicinal information through to the doctor, pass through their blood pressure and things like that. So you've got the telehealth aspect of it. But people can FaceTime, so they can chat to their families. So the family can call them. And then there are some specific dementia apps for stimulation with quizzes and puzzles and games. And there's just normal phone games, that I play on my phone. And some of them people with dementia will be able to use for quite a long time, like the match three games and that they can have a go at. Because if you don't use, you can have the ones that aren't timed, so people can take their time with them. And it's a way sometimes of passing the time instead of um, sometimes they don't feel like chatting to people, they feel like some quiet time that they can keep stimulated by using their phone. But it does mean that if they want to FaceTime their granddaughter or something, they can do it sort of quite easily. In a nice private space as well. So, with their tablet or with their phone. They don't always have to be in the day room. They can talk to their family in their rooms on their tablets, and it's quite nice. And getting out and about in the community is obviously fresh air and walking doesn't do anybody any harm. Um, Going to venues that have specialist events and activities for people with dementia. I've already mentioned the dementia friendly cinemas. There are some special live theatres that often run in local arts centres for people with dementia. Sensory gardens are really lovely. They would be a garden designed to provide sensory experience with scented plants, plants that make rustling noises, usually nice water features. And often you can take people from a care home just out for a trip. You might have to arrange it with them if you've got a bigger group. And people just enjoy wandering around the smells and the colours. Sometimes just going to a local garden centre and looking at the flowers and then having a coffee afterwards is quite enough for some people. I mean, if the people live by the coast, the beach walk is nice, or in some nice scenic areas, some simple walks through the woodlands when the bluebells are out, when the flowers are out in the spring, is quite popular as long as people are okay on their feet. So getting out and about in the community, taking a particular individual out shopping for something that she particularly wants, some new toiletries or a new dress or something like that, is always a nice event. And it helps people be part of the community as well. Usually stopping for coffee afterwards to see what's going on in the local area.